Hi everybody, I am Dr. Aminuddin Owaisi. I am a consultant interventional cardiologist at Care Hospital, Nampally, basically involved with interventional work, and I am a heart failure specialist. Today I want to speak to you about a very important topic, which is heart failure. And why I chose to speak about this topic is because heart failure does not usually start with the typical symptoms that are associated with heart disease. Most people think that pain in chest is the main symptom in any heart problem, but heart failure usually presents not with pain in chest, but usually with shortness of breath. Now, most people, when they have shortness of breath, they associate it with a lung infection, and which may be true for a lot of times, and especially after COVID, people are always thinking about viral infections. But heart failure is basically a disease where the heart becomes weak due to many factors. Could be a previous heart attack, could be due to your arteries not supplying enough blood, could be due to long-standing hypertension, BP, or diabetes, or it could also be due to viral infections which can cause viral myocarditis, which is basically an infection of the heart. And one of the major symptoms of heart failure is shortness of breath. People will usually come to the emergency complaining that they have shortness of breath, they are unable to breathe, or they feel a lot of shortness of breath and when they are walking. And one of the worst symptoms is usually when they say that even when they are sitting and they are resting, they feel that they are unable to breathe and they have shortness of breath, and when they are lying down it becomes worse. So one of the main symptoms of heart failure is when a person lies down, the shortness of breath increases and he feels that he needs to sit down or stand up. The other symptoms of heart failure is usually edema in the feet, with basically swelling in the feet and the hands. Now, heart failure can also sometimes come along with the kidney disease. So, in case the kidney is unable to excrete enough fluid out of the body, then in that case, you will also experience people who will have fluid overload. They will have a lot of water left retention in the body, and that will cause them the fluid to overload, and that will also cause heart failure. Now, why heart failure is important? Because heart failure is one of the main reasons why people get admitted into the hospitals for any heart-related complaint, and it's also a major cause of death if left untreated. Fortunately enough, nowadays we have a lot of treatments available for this. It usually starts with diuretics and with a lot of medicines that we have. We have, we can always give medicines to decrease the fluids. We also have enough new medicines that can cure it, that can improve the pumping of the heart. So in heart failure, basically the pumping of the heart goes down, and there is a lot of things. So I think what I wanted to say, the message is the treatment is there, but the symptom is shortness of breath. And so if you ever experience this kind of shortness of breath, and and if it's not getting cleared up just because you have taken something for the lungs, then probably it is heart failure. So in that case, you should always consult a cardiologist. Thank you, and that's all for today.